My symptoms started off with me losing weight, and then all of a sudden I couldn't hold anything down, so I went to the doctor. That's when I found out I had cancer of the esophagus and the top of the stomach.
I was diagnosed with stomach cancer about 4 months ago. Well, I was shocked and could not believe it because I always feel that I'm so strong. Unfortunately, I have the cancer, but I will fight it.
Cancer is when your body's cells start multiplying uncontrollably and they crowd out your normal cells. When cells divide uncontrollably, they can oftentimes collect together and form masses, which we call tumors. The role radiation plays in treating or curing cancer is that it can kill the cancer cells. Radiation is just like an X-ray. The difference is the energy of the X-ray is strong enough to penetrate through the body and cause direct damage to the DNA in the cancer cells. And then they die because they're not able to repair that DNA damage. Healthy tissue is also exposed to radiation therapy. The difference is that healthy tissue is able to repair any DNA damage that it sustains, while the cancer cells cannot. Upper GI cancers include cancers of the esophagus, stomach, liver, pancreas, and biliary system. Surgery can be the main tool used to treat the cancer, while chemotherapy and radiation are often used in addition to prevent the cancer from coming back or shrinking it prior to surgery. Oftentimes, when the surgeon performs their surgery, they can't see any microscopic disease. Radiation therapy is often used to kill any potential microscopic disease that's left behind.
I have this information for you. This is a little pamphlet from Astro.
For their first appointment, patients should expect to be seeing a radiation oncologist and a nurse. They will not get treatment, they will get options. Patient education is important for patients and family because it helps them make informed decisions.
When's the appointment with the surgeon? Do you know yet?
We highly recommend patients to come with a family member or a friend for their first consultation with a radiation oncologist. We want them to have that support, to ask the doctors questions and to take notes.
All right, now this bag here, I'm gonna make it soft, and then I'm gonna conform it around your arm so that it's holding you in position so that you don't have to do any of the work, okay?
The first step after your consultation is a CT simulation, also known as your planning session. At this session, we put you in the position you'd be in for your treatment, and we create immobilization devices.
Immobilization devices are used to make sure that there is accurate positioning and repositioning for patients from treatment to treatment. CT simulation is a process where the therapy team can locate the exact size, shape, and location of the tumor so they can take images for planning purposes.
We take a scan of your body in that position, and that scan is imported to my treatment planning software. In some simulations, we will do a 4D scan where we can actually see the movement of your organs in real time. So this way we can ensure safe and accurate delivery of radiation. On the day of simulation, you may have an IV placed, which is used to give contrast so the radiation oncologist is able to identify regions that they may want to target.
You're gonna feel a little pinch, okay?
At simulation, marks are often placed on the patient, which are then aligned to lasers that sit in the walls on treatment delivery days.
The tattoos are very small, like a freckle, and you can almost not see it.
After simulation, we take the images from your CAT scan and we use it for treatment planning. This is called dosimetry. The radiation oncologist works with the dosimetrist and physicist to come up with your radiation plan.
As a dosimetrist, my role is to perform calculations and treatment plans for each patient. It's under the guidance of the radiation oncologist and the supervision of the physicist. Dosimetrists are highly trained in the placement of beams and how to target the tumor and avoid normal structures and organs that don't need to be treated.
The radiation oncologist, together with the dosimetrist, will draw the areas we want to treat with radiation and the areas we want to avoid with radiation. We then use those drawings to aim how we're going to target the radiation specific to your anatomy.
We are able to attack the tumor from multiple directions by using different beam angles and angling the table.
The radiation therapy plans are highly individualized to your anatomy and are very precise.
The physician will look at the plan and approve it. Once that is complete, then our physicist checks our plans.
The physicist does all the quality assurance and checks on that plan, and also does the checks on the machines to make sure they're calibrated correctly to deliver very accurate radiation. There are different kinds of radiation that are used to treat GI tumors. You have 3D conformal radiation therapy, where we aim X-ray beams at the patient and we actually physically shape those beams to protect the normal tissue and target the tumors. Another type of radiation therapy is IMRT, which is known as intensity modulated radiation therapy. And the computer program runs models where they tell the machine to block and open the beam as it goes around the patient to create that plan. Another form of radiation therapy is SBRT, or SABR, which is stereotactic body radiation therapy. This technique of radiation uses very precise immobilization and high doses of radiation in 1 to 5 treatments to destroy the tumor and spare normal tissue. There's no one best radiation treatment for all types of upper GI cancers. Your radiation oncologist will determine which is the best treatment for you.
You can just put your bag right there.
As a radiation therapist, we are the ones that actually give you your treatment that the doctor has prescribed. When a patient comes in the room and they're on our treatment table, we will help them get into their immobilization device. We use marks that we put on the patient, and we have laser lights that come off of our walls and our machine to make sure that the patient is in the same exact position every day. It is very important for the patient to be comfortable and relax. Every effort is used to maintain modesty for our patients.
Prior to you receiving the radiation treatment every day, an image is taken and compared to the initial imaging we took at your simulation. We then look to see if you have to be moved, and we make the adjustments prior to your treatment. This is known as image-guided radiation therapy, or IGRT.
We're going to start your treatment now.
We have video and audio connection with the patient at all times, and we treat the patient from outside of the room. During the actual radiation treatment, the patient can expect to hear some noises coming from the machine. The machine might rotate around them. They're not going to feel anything.
That's it for today. We're going to get you down.
I don't even know that it's finished. So regardless of all the side effects, treatment is not bad.
Some upper GI patients will get a PEG tube. This is a tube placed into their stomach to help with enteral nutrition for those that cannot really tolerate it by mouth.
Patients should expect to see their radiation oncologist once a week during their treatment to check in on them and ensure that their side effects are being well managed.
For patients undergoing radiation therapy for upper GI cancers, it is very common to see dry mouth, lack of appetite, which leads to weight loss. It's also common to see nausea, vomiting, and also feeling of being tiredness and exhausted. We can prescribe medications or do nursing interventions as necessary.
The effects occurred 2 weeks after my radiation starts. If I think about food, I feel the nauseous. If I taste the food, there's no taste. And when I eat it, it's nauseous. So it's been a little bit tough. The side effect is worth it to fight for the cancer.
Every patient responds to radiation differently, and so some patients may experience other side effects, and it's best to talk to your radiation oncologist.
Most patients are able to drive, when they are on radiation therapy. In fact, a lot of them can still go to work. But we advise patients to listen to their bodies and plan rest periods. We highly recommend our patients of childbearing age to talk to the radiation oncologist or medical oncologist to talk about fertility and get referred to fertility clinics for egg preservation or sperm preservation.
Radiation therapy is a very effective and important tool in treating upper GI cancers because it can help get rid of microscopic disease, help shrink tumors prior to surgery, and in some cases destroy tumors completely.
We gonna fight. We ain't got nothing else to do but fight. We gonna beat this.
As a patient, you will not go through this alone. You have a team of experts behind you who can help you, guide you, and educate you.
It's tough, but you can win this.